Imagine looking at your medical practice's projected incentive revenue for the entire year. You see a number, let's say roughly around $60,000. It is decent money, sure, but considering the sheer volume of patients you see, the late night charting, the administrative burden you carry, it feels underwhelming. It feels like you are doing a lot of work for a bonus that barely covers a fraction of your overhead. Now imagine performing a specific set of data audits, cleaning up your care gap reports, and looking at that exact same projection for the next year. But this time the number isn't 60,000. It is nearly $280,000. That is almost a 5x increase in revenue. Did this practice see 5 times more patients? No. Did they work 5 times more hours? Absolutely not. Did they hire 5 times more staff? No. They simply unlocked the enhanced tier. Today, we are analyzing a real world case study of a primary care practice, ABC practice. We are going to break down how exactly they moved from Healthfirst's essential quality incentive program to the enhanced program, right? And we will see what triggered this financial windfall. If you are stuck in the essential tier, you are leaving 6 figures on the table. Let's get that incentive back on your quality performance. Welcome back. If you are new here, we help medical practices navigate the complex, often frustrating world of value based care to maximize revenue and patient outcomes. Today, we are doing a deep dive into a specific payer scenario, Healthfirst. We are dissecting the critical difference between their essential quality incentive program, which is the default bucket where most practices start, and the enhanced program, which is where the real profitability lies. I want to introduce you to the subject of our case study, ABC Primary Care Practice. In 2024, this practice was operating under the Essential Plan. They were doing good clinical work, seeing patients, filing claims. But when we looked at their total potential earnings, combining their incentives from Medicaid and Medicare based plans, they were capped. Fast forward to their 2025 projection, by executing a strategic upgrade, their total potential skyrocketed to $280,000. Right? So, this video is an educational breakdown of how that happened. We aren't just going to celebrate the numbers, we are going to reverse engineer this strategy so you can replicate it. We will discuss the role of data audits and the critical nature of closing care gaps. By the end of this 10-minute session, you will understand why ignoring your quality tier is the most expensive mistake you can make this year. Let's start by dissecting the before state. I call this the essential trap. In 2024, ABC practice, a community practice, was designated in the Healthfirst essential tier. They had an earning potential of almost 50K from this LOB, which is PHSP, stands for Prepaid Health Service Plans, and they had an earning potential of almost 10K from this LOB, which is MCR, usually Medicare based plans, right? Now, what does that actually mean? Payers, they segment practices based on performance metrics and panel size. The essential tier, which you see here in the sub program, it is essentially the baseline. It is the default setting. When you are in this tier, your incentive multipliers are somehow suppressed. You might be doing the work, checking blood pressure, managing diabetes, ensuring screenings happen on time, but the reimbursement structure for that is kept at minimum in this tier, which is the essential tier. So for ABC practice, the math was brutal. Look at this dashboard again on your screen. Even if they hit 100% of their targets, like if they were able to achieve this full $10,000 from Medicare based plans, and if then they were able to achieve this full amount, their total incentive for 2024 stood at $60,000 only, right? So when you add up the incentive potential from both LOBs, that is Medicare and the prepaid health service plans, the total sat at around $60,000. The problem here is psychological as much as it is financial. When a practice sees a maximum reward of roughly 50K to 60K for a year's worth of data reporting and population health management, the natural reaction is skepticism. You ask yourself, is this worth the effort? The administrative cost of chasing those quality measures, it often feels equal to the reward. So, what happens? Practices, they prefer to stay in this essential tier. They treat the incentive program as a nice to have bonus rather than a core revenue stream. Mhm. But here's the catch. The essential tier, it is not a safe harbor. It's a cage. By staying there, ABC Practice wasn't just losing money in 2024, they were endangering their future attributions. Yeah. As we have discussed before, pairs, they prioritize high performing practices. If you stay in lower tier, you aren't just capping your bonus, you are capping your growth. Mhm. So this practice realized that $60K wasn't going to cut it. They needed to break out. And so is what they did. So now let's look at the after state. This is the 2025 projection for the ABC practice. Because they executed a specific strategy, Healthfirst re-evaluated their standing. They were promoted to the Enhanced Quality Incentive Program. The difference is staggering. Look at the visual proof on the screen. In the essential tier, that line item was capped at 10K. If you remember, in 2024, under Medicare based plans, which is MCR, they had a potential of only 10,000, right? But now in 2025, when they started performing and showing performance by closing care gaps, now in the enhanced tier, the maximum earning potential for the same LOB becomes 43,000 plus dollar, right? And look at what happened to the prepaid health service plans. The practice moved up from almost $50K in the essential tier back in 2024 to 140K plus in enhanced incentive plan. Look at this one more interesting thing under the enhanced. As the practice consistently closed more care gaps under the enhanced, you see they earned some revenue as January passed, February passed under the new quality incentive program, which was the enhanced. Enhanced tier also increased their maximum incentive potential. So they jumped from 140 to $235,000. Let's do a math on that. Let's do a little bit of math. Now, what that means for their total incentive potential for 2025. If we add both LOBs, which is prepaid health service plans, and then the Medicare based plans, their total incentive potential is almost $280,000, and that is expected to increase as they close more care gaps. That is a 5x increase compared to their earning potential in 2024. If you are a practice owner or an administrator, I want you to pause and think about what an extra $220,000 in pure profit does for your business. That pays for 2 full-time nurses. That buys a new ultrasound machine. You can upgrade your waiting room. This is a substantial bonus. And remember, did they work 5x hard? They simply aligned their clinical reality with the payer incentives. This is the power of enhanced label. It is not a vanity metric, it is a financial multiplier. So it is like the payer is essentially saying, because you have proven you can manage this population effectively, we are going to pay you significantly more for every single action you take. All right. So the screenshot from our case study showing that jump from $60,000 to $280,000 almost should be enough to make you call your office manager immediately and ask, what tire are we in? Right? But before you make that call, you need to understand the mechanism of action. How did this practice actually achieve this increase in incentive revenue, and what they exactly did to move from essential to the enhanced? So, how do you go from a 60,000 potential in incentive from just one pair to a nearly $280,000? How do you do that? It wasn't by seeing more patients, obviously. I cannot stress this enough. The upgrade, it didn't come from volume, it came from value. The strategy it involved, are you ready for that? A comprehensive data audit. Yes. Most practices, they assume their EMR data matches what the insurance sees. That is almost never true. ABC practice reconciled their internal records with Healthfirst data. They found a lot of discrepancies. Patients who had received care but weren't being credited for it. This is a low hanging fruit. Revenue that you have already earned but haven't been paid for because of a coding error or a missing supplemental data file. Often the work is done, but the code didn't drop. Fixing this is pure administrative cleanup, but it pays dividends, right? So, watch the video that I linked on the top to make sure you are auditing your care gaps data correctly. Now, moving from essential quality incentive program to the enhanced quality incentive program, it has a secondary benefit. And that secondary benefit, it is arguably more important than the immediate cash. It is about longevity and patient volume. I went into great detail on this in a previous video titled Your Care Gap Score Determines How Many Patients You Get. If you haven't seen it, I highly recommend watching it after this. So basically, the summary is that as you consistently close more care gaps, the payers will attribute you more patients because you are performing well, right? So, that is what we need to keep doing as a practice. And that is what ABC practice did. By upgrading their tire, they didn't just get a pay raise on their current patients, they effectively opened the floodgates for new patients. So, the care gap score is your report card. Keep closing care gaps, improve health quality outcomes, keep getting incentives.